I work at Team Iowa Physical Therapy. We're located at North Dodge Athletic Club, which is in Iowa City. We have 8 physical therapists and 4 business admins. Our clinic first opened up in March of 2017, and it just started as 1 physical therapist, my boss, Joe Nelson. And then since then, we have grown. We've hired almost every year since then. And then our business administration team has grown as well, because as I'll talk about later, there is a lot of things we do with insurance, and we really need a strong business team to help with that. So how many of you guys have had physical therapy before? Have you guys ever been to a PT clinic, had an injury, or maybe a family member that's had PT? So physical therapy, this is actually just a definition from, I think, Wikipedia. So in other countries, you might hear it called physiotherapy, but it's a healthcare profession that promotes, maintains, and restores health. And we do that through a couple different ways: patient education, physical intervention, disease prevention, and then health promotion. So in order to become a physical therapist, you will need an undergraduate degree, so a bachelor's degree, and then you also need further schooling, graduate schooling, in order to obtain your doctorate of physical therapy. So typically that's going to be 4 years of undergrad, and then some PT schools are 2.5 to 3 years. So that is going to be about 7 extra years of schooling after high school. Physical therapists can work in a lot of different settings. So a hospital is one setting. So they might be working in inpatient, they might be working in acute care. Sometimes there's even PTs that work in the emergency room. I work in an outpatient setting, which just means a clinic that's not attached to any place where people are staying overnight for medical care. So we see musculoskeletal athletes post-op, like they just had a surgery, kind of general population. Some other more specialized settings are going to be neuro care, which that could be for if someone had a stroke, traumatic brain injury, Parkinson's, cardiopulmonary, so things dealing with the heart and lungs. PTs also help with wound care, pelvic floor. That's one of my specialties. I see a lot of moms after they've had babies, or even during pregnancy. And then a couple other settings might be skilled nursing facility or long-term care if someone was in a big accident and needs kind of ongoing treatment and medical care, as well as a gym. So we are connected to a gym at Team Iowa. I listed just a couple common conditions that we see specifically at Team Iowa, which again is an outpatient clinic. So post-op, if people have had a total knee replacement, rotator cuff surgery, labral repair, ACL, meniscus repair. We see general low back pain, neck pain, plantar fasciitis, ankle sprains, a lot of athletic injuries, so shin splints from running, just general knee pain, tennis elbow. And then, like I mentioned, pregnancy and postpartum is one of my specialties. All right, so what do? We do a lot as PTs. It's a very hands-on job. So we are touching our patients to assess and to treat. We take patients through an evaluation, and I'm going to dive deeper into these on subsequent pages, but just kind of an overview. We do an interview with them. That is our subjective portion of the evaluation. And then our objective portion of an evaluation is we're looking at their range of motion, their strength, things like that. There's a lot of different kinds of treatment, and I'll go a little bit deeper into all these different treatment techniques that I listed. PTs are also the ones that are responsible for establishing a plan of care. So how long do we expect to see this patient? And then we also need to do reevaluation. So we want to make sure patients are making progress. Otherwise, it's not really worth their time or our time for them to come to PT. And then our ultimate goal is to discharge the patient. So let's see. So how many of you guys said that you have been to PT? Raise your hand. If one, okay, Emma, Delaney, Kaylee, awesome. So do you remember the first time you went? Did they kind of ask you questions Like, why are you here? What happened? So that's what we call the subjective part of the interview. So we want to know, why are they coming to PT? We want to know, how did it start? Was it gradual, or did you fall in a hole and sprain your ankle? Kind of what that mechanism of injury is, where we abbreviate that as MOI. We want to know what makes their pain better or worse, because that is going to help tell us, is it a muscular problem? Is it a tendon problem? Is it a mechanical problem? We also want to know what they have already done to help. So a lot of times when our patients come, they've already been taking ibuprofen, or maybe they've been trying to ice it, things like that. That's going to help let us know how we can help them. And then we want to know what their past medical history is. So as doctor to physical therapists, we are medical providers. And so we do need to take into consideration, like, do they have underlying heart issues? Is their shoulder pain actually coming from their shoulder, or is it coming from their heart and we need to refer them back to their doctor? Same with medications. Are they on any medications that might impact their treatment plan? Are they on blood thinners? Things like that. So then we get into an objective, which that is when we are using our skills as physical therapists to evaluate what their issue is. So we observe how they move. Palpation means touch. So we feel them. We see, oh, is your shoulder tight? Is it your upper trap muscle? Is it your rotator cuff? We look at range of motion. So we see, are they limited with reaching their hands overhead, behind their back? Can they bend through their spine? We are also testing their strength and their joint mobility. We are looking at if they have any numbness or tingling or sensation losses. And then special tests are a term that we use for different positions that we put patients in to see if we can aggravate their symptoms. And that's going to help tell us where their pain is coming from. And then we also always want to make sure we're looking at their function. So are they having trouble walking? Are they having trouble getting up and down the stairs? Things like that. A lot of different kinds of treatments. So we divide treatment up into different categories. And I'll just touch a little bit on these. Manual therapy is what we consider using our hands, so massage, but we also will consider using different tools as part of manual therapy. So at our clinic, we do cupping, we do dry needling, we use different massage tools. Neuromuscular re-education, we're looking at things like balance. Therapeutic activity, this is a really important one for physical therapists because we're looking at their functional movement. So squatting, stepping, things like that. Whoops. Therapeutic exercise, we're trying to build strength. And then a couple other ones, self-care, how can we help them at home with activity modification? Gait training is just another word to describe walking and running. And then we do use different modalities such as heat and ice to help with pain. So, okay, I want to get you guys a little bit involved now. So if you guys have access to the chat box, we're going to go through an example case. And I just want, kind of based on maybe your previous experiences or just what I went through, what are some things you might need to know? So let's pretend you're a physical therapist and someone comes into your clinic and they have low back pain. They come in and they say, oh, my back hurts. What are some things you might want to ask them? Feel free, just type anything in the chat box. Let's see, I'm just gonna stop sharing my screen for a second. Okay. So what do you guys think? What are you gonna ask this patient? Yeah, like what, like why did your back start hurting? Did you wake up with it one day, or did you fall? Were you in a car accident? Yeah, really important. What else might you guys want to know? Yeah, was it sudden or gradual onset? Really good. That tells us a lot about kind of prognosis too. When did it start hurting? Yeah, do certain moves hurt more than others? That's great. That goes into that category of aggravating or easing factors. Are there positions that make it hurt more or worse? Yeah, does it affect your everyday life, or is it like not that bothersome? Good, you guys. What are some things that you maybe want to look at? So they come in and they say, my back hurts. It started 2 days ago. I tripped over a branch on the sidewalk and I hurt my back. What do you think as a physical therapist you want to look at? Yeah, look at their mobility. How are they moving? Are they able to bend down and touch their toes? Can they lean back? Can they twist side to side? Super. What else do you think you want to look at? You guys remember what I said PTs do every day? We use our hands. We touch people. We feel their muscles. So one thing that I'd probably want to do is I'd want to poke their back and see where in their back is it sore. Is it one side? Yeah, look at what movements cause the most pain. That's great. That's going to tell us maybe is it more muscular or did we hurt a nerve in our back? Good. So this one's kind of tricky because I didn't talk a ton about treatment, but maybe those of you that have had PT, what kinds of things do you think you might give this patient? Let's say they come in, they say they tripped over a branch, they hurt their lower back, and now it hurts them to bend forward and bend backwards. What do you think you might do for them? What do you think we have patients do when they're at the PT clinic? Doesn't have to be super specific. Yeah, home exercises. You got it. Yeah, definitely. We're gonna want to give them maybe some stretches to do. Yeah. Yep. We might do some heating or icing, especially if it's an acute phase, so meaning it happened right away. We might tell them to ask their doctor for medications. We can't, as providers, as PTs, we can't tell them to take any medication. But we might say, hey, maybe ask your doctor, is ibuprofen something you could take? Will that interfere with any of the other medications you're taking or any medical conditions you have? Yeah, but we're probably going to do some massage to this patient as well. Good, you guys. And then the last one, how do you know the patient is making progress? What are you going to kind of gauge? How do you know if they're getting better? Let's say the first day when they come in, they can't put their shoes on. They can't pick up their dog. What might be some ways you know the patient's making progress? Yeah, if they tell you, if their pain levels aren't as severe, or you can also look from session to session to see how their mobility is. Are they able to bend down, put their shoes on? Can they do things like that? Good, you guys. That was kind of tricky. You guys did great. I'm going to go back to sharing my screen again, I think. Okay, let's see. Okay, can you guys see my PowerPoint again? Awesome, okay. Let me just pull this over. Okay, so let's just talk about some pros and cons of being a physical therapist. So these are what I consider my pros and cons. So I really like working with people. So as a physical therapist, I get to work with people all day long, and you are able to spend a lot of time getting to know your patients because we typically see them anywhere from 30 to 60 minutes a session. And a lot of times these people are coming in once a week, sometimes twice a week, sometimes 3 times a week. And you're seeing them for a long period of time. So you get to know them, which is awesome. You get to help change their lives because when they come to you, maybe they're in pain, or maybe they're just not able to do something that they want to be able to do. So you are helping them. It's a really active job. We're on our feet all day. We're bending, we're showing exercises. So I think PT is a great profession for someone that knows they don't want to sit at a desk all day. Every day is a little bit different. You're going to see different patients every day. Patients' personalities are different, their injuries are different, and you sometimes will plan something for a session and then the patient comes in and they throw you a curveball. Let's say they hurt a different body part. So it does keep you on your toes, which I really like. And then it can also be a team environment. So, for instance, in my clinic, I work with a lot of other PTs, so I'm able to bounce ideas off of them. But it can also be a team environment considering the other healthcare providers we work with. So, we are frequently being referred patients from physicians, and we're also referring them back to physicians in certain instances. So, a lot of things I really like about being a physical therapist. There are a few things I don't like about being a physical therapist. So we do a lot of paperwork because we have to document all of the things we do. That for one is what we submit to insurance. So that's how we get paid. And it is also important to document everything for a liability standpoint as well. So like I mentioned, we are submitting things to insurance, and sometimes insurance likes to tell us what we can and cannot do with a patient, even though they are not the healthcare providers. So occasionally we will run into an insurance denying a patient's visit, which is really frustrating when you know the patient needs more PT and insurance is saying, no, we're not going to pay for that. A few other cons are dealing with the patients. You know, sometimes they hit a plateau, sometimes they're not doing their homework, and you're trying your best to get them better, and they're, you know, for whatever reason, you're just not making progress. That can be frustrating. And then, kind of the other thing I think that's important for people to think about is it is a lot of schooling, which sometimes leads to a lot of student loans. So, when you're thinking about going to undergraduate and graduate school, just knowing what that might cost. I mentioned before, how do you become a physical therapist? So I mentioned that you need an undergraduate degree and a doctorate degree. But to break that down just a little bit more, you need a degree from a four-year university. So usually that's going to be a bachelor's of science. When you are in undergrad, you are going to take the GRE, which is a test for graduate school. You are also going to need observation hours. And the reason why that's important is schools like to know that you have considered, you know what a PT is doing. So you're sure that you want to go into school, and that's your opportunity to ask a PT questions, to watch, to learn. We always ask that our observation students sign a HIPAA form. HIPAA means it's just basically an agreement that you are not going to disclose personal medical information. So when we have students that come into the clinic, they sign that, and that means that they cannot go tell their friends who they saw in the clinic that day. A few other things that you will work on when you're an undergrad is kind of a broad resume. So PT schools are looking at what activities, work experience, volunteering you've done. They like to see that you have done things related to physical therapy, but they also like to see that you're a well-rounded individual. So maybe you volunteer with a club or a church, maybe you work in a lab, just things like that that are going to make you a diverse candidate. So those are all the things you do in undergrad. Then you apply to PT school. Usually that there's going to be an interview process with that. Then you go to school for 2 to 3 years. After that, you need to take a licensure exam. And then once you are licensed, you have to take continuing education credits every 2 years. So you're taking online or in-person classes that usually have exams associated with them. But that's pretty low stress. I would say continuing education is easy to do because there's a lot of things when you are practicing PT that you want to learn. So it's nice to stay current with all the research. And I think just a few other things, if you guys are interested in PT, just knowing what other professions might be similar, because you guys are still so young, you can look into so many different things that interest you. But if you like PT because it is in healthcare and it's an active job, you might also look into physical therapy assistant, which is an associate's degree. That means less schooling. A physical therapy assistant is going to work underneath a PT. A few other therapists are speech therapy, occupational therapy. Athletic training is a little bit different than PT, but similar. Recreational therapy or research. So researching the different, how people walk, things like that, and how muscles heal. A lot of different research options.